My name is Joy Rodriguez, and this is Leilani Maxera. I'm a bedside end-of-life doula, and I'm joined by Leilani Maxera, a licensed clinical social worker, therapist, and death worker. We both live on Honolulu, and for over a year now, we've co-facilitated an ongoing drop-in group for people in Hawaii with medical aid in dying specific bereavement. Through our interactions with participants, we have learned of their desire to tell their stories and in hopes that their loved ones' deaths can be a tool for learning. We're grateful for the opportunity to share in their experiences.
Thank you, Joy, and thank you so much. Again, thank you so much to everybody for coming today. We really appreciate it and are excited to see so many folks RSVP'd and showed up. So just to give an overview of what to expect today, we have 5 participants of our medical aid in dying bereavement group who are here today to tell you their stories via pre-recorded video. And then after each video, Joy and I will be asking a few questions of the speaker from the previous video. And after watching all of the videos, at the end, we will have plenty of time for questions from the audience. And you can ask questions via either the chat, or you can use the hand-raising function on the computer to raise your hand, and when you're called on, you can unmute yourself to ask your question. We ask that if you have a question that's specific to one person, that you let that be known. So if it's specific to one of the speakers, if you put a question in the chat, please say so and share their name. And then we also ask today that you give our speakers your full attention and respect. We take this topic very seriously, so if anybody does unmute yourself and interrupts the speaker or disrespects the speaker in any way, we will just automatically remove you from the Zoom. So please wait till the end and unmute when you are asked to speak, or please put anything that you would like to ask of us into the chat, and we will try to get to it as soon as possible. So before we get started, we also just want to introduce Danielle Pacific, who's our third co-host today, our friend here. And I think I can spotlight them now that they have their video on. I couldn't earlier because the video wasn't on. But this is Danielle, and Danielle is our cool tech person today who is going to be behind the scenes. They're also an end-of-life doula on Hawaii Island, and they're going to help us out by doing tech stuff. So if you have any tech issues during this, please chat with Danielle, send Danielle a message. So that's Danielle. Thank you, Danielle, for being here and helping us out. And thank you everyone for sharing this space with us today. Again, we just really appreciate that you took the time to come and be with us and hear everybody's stories. So without further ado, I'm going to go ahead and share screen and share the first video, which is for our panelist, Clark Tyler.
My wife, Nancy Grover, was diagnosed in 2008 with breast cancer, and she had a surgery to remove the tumor, lumpectomy, and then we sought out treatment in California for her, and she was diagnosed as cancer-free at that time after the treatments. And in 2017, the cancer came back through diagnosis and PET scans and the blood work. It was coming back, and she had treatment with oncologists for almost 3 years, and then in 2020, beginning of the pandemic, the cancer came back big time and was causing severe health problems, and we had to travel to Oahu to get treatment several times for her bile duct stents, and in August she went on continuing care hospice. And at that time we were introduced to the option of medical aid in dying by her hospice nurse. And she told her that at least get the paperwork done. You don't have to do it, but if you get the paperwork done, it's going to save a lot of hassles later on. So she did get the paperwork done. And then probably about a year, maybe not quite a year later, she was getting worse, and the chemo drugs were not helping her. She was doing oral chemo, and nothing was slowing down the cancer progression. So she opted to get the drugs, do all the interviews, the doctors signed off, and we ordered the prescription. And we received it, and her cancer was such that she had a lot of nausea and vomiting, and I had always kind of freaked out about her taking the drugs, but we got an alternative with the rectal way to take the meds. And at one point she got to where she couldn't eat or drink. She was vomiting, and she said that I don't want to do this anymore. And so she called the hospice nurse. The hospice nurse came over, and along with the hospice doctor, and they grilled me and taught me how to do the enema thing with the syringe, how to mix the meds, just mix them with water, pour it in. And so they left the room, and I mixed the meds, poured them into the large syringe, and I was holding the syringe, and Nancy said, "Let me hold it, I'm gonna do this." And she pushed the syringe in and administered the meds herself. And then she said, "Come lay with me and hold me." And I told her I love her forever, and she nodded and smiled, and that her granddaughter loved her forever, and she went to sleep and was gone within 15 minutes or less. She stopped breathing, and she was declared dead 15 minutes later. And this was the right thing to do. I'll always believe that. She was a courageous person. Thank you for listening.
We're really happy to have you, and really appreciate that you came to share your story today. So I have a couple questions for you, just based on, and also I just want to say I really appreciate meeting Clark through our bereavement group. He was the first person to ever join, and I feel so lucky to have got to know him and to have got to know Nancy's story over the past year. Clark, in your video, you said that the hospice nurse told Nancy about the medical aid in dying option well before Nancy was ready to use it. How did the two of you feel when you first heard about it?
Actually, Nancy was inquiring about it, before she even got in hospice, and we were looking into it. So, she always knew that was out there, and it was a kind of a relief that the hospice nurse did introduce us to it and told us where to get the paperwork and everything. And, it was kind of a relief for her.
Thank you. When Nancy decided to ingest the medication, she was already vomiting very easily, and since the cancer was in her stomach. So Nancy decided to take the medications rectally. I know a lot of people are very intimidated by the idea of rectal administration for the medical aid in dying medications. Do you have any advice about this process?
Well, the alternative is she would have ingested orally and thrown up, and that was kind of my worst nightmare. And so our hospice nurse reached out to, I think, Michelle Cantello and some other people on what we could do, and also the hospice doctor. And they came up with this. They even came out to our house and we met, and you know, she was already on hospice and having some drugs administered that way anyway, so it was no big deal. It was really, you know, like a weight off our shoulders when we found an alternative way to administer it. So, you know, it's no big deal. It was no big deal for Nancy and myself. So I don't know. That's just us though. So.
Okay. Thank you. Thank you for sharing. And then Nancy and Justice, when just the two of you were in the house, how did you feel about that?
I think that's what Nancy wanted. You know, I was great with it. You know, both the Dr. Long and Miriam, the hospice nurse, were here, and then they left, went outside, and I texted them after Nancy stopped breathing, and they came back in and pronounced her dead. But yeah, that was very intimate, and I'm sure that's what she wanted.
Did you feel supported by the medical professionals that you worked with?
Most of them, yes. Yes, there were a few that didn't want to participate in the process with us, but we found alternatives. Our GP, she was great. She was the second to sign off on it. We had I guess Michelle got us an appointment with an oncologist on Oahu that did the interview and ordered the meds, and our GP signed off on it. It was the second doctor that signed off. So for the most part, yes.
Okay. And then my last question is there anything that you would like to see changed about this process?
Just the time frame from, you know, that waiting period or something before you can get the meds. But it didn't really have an effect on the way Nancy took it or cause any issues, but I can see where it would with somebody who just is really suffering and wants to take the meds. I think that should be reduced. That's my only issue. We had a lot of support from hospice and some of the other people here on Kauai.
Thank you. Thank you so much for sharing. And just a reminder to folks that you'll have time to ask questions of Clark at the end after all of our speakers, if you have questions specifically for him. And thank you again, Clark. Much appreciation for you sharing with us today. Our next speaker we're going to hear from is also a video, so apologies again for the tech issues. I'm going to try not to touch my screen at all so that it doesn't stop. But our next story comes from Momi Loveland.
Hi, my name is Momi Loveland, and I'm here to share my family's journey with the MAiD process. This is my dad, David Morris, and my little family, minus myself and my sister. That was Thanksgiving 2019. Shortly after that holiday, we found out my dad had stage 4 lung cancer and stage 4 kidney cancer, 2 separate cancers. A decision was made to fight the lung cancer, so he started chemotherapy in February of 2020. Up until 2022, he didn't get worse. He wasn't getting better, maintained. April of 2022, we found out that the cancer had spread from one lung to the other. So a decision was made to do 3 straight weeks of radiation treatments to slow it down. And we thought it worked because he was feeling a little better afterwards, gained a little weight, was a little bit more mobile. And then he just took a nosedive. He started to lose weight, started to get very tired. He started developing these nodules on his body. After more scans and tests, we found out that it spread to his lymph nodes and into his brain. He was pretty much terminal at that point, and he decided he was done. So we enrolled him into hospice, but prior to that, he had made a decision to do MAiD. So I had to find out about that. So I went onto the Compassion and Care website, I found zero information for Hawaii on the website. So I emailed and they reached out to me, explained the entire process, told them we were Kaiser patients. They told us what we needed to do. So we made our declaration with Kaiser, and that's when they finally started talking about the MAiD process. Up until that point, there was no mention of it, just mostly hospice. In hospice, they told us, one, they wouldn't support us during the ingestion, but would be there afterwards. They also had prescribed him, pain medication, but he refused to take it because he knew he needed to be mentally stable to go through this process. He knew he had to talk to doctors. He knew he needed to be coherent. So he suffered. Again, everything he's done up to that point was his choice. So mid-September, I got a phone call saying I can come and pick up medication. Well, I was not prepared for this. That's 8 bottles of medication. Pharmacist, one after one after one after another. I stood there and cried in Kaiser, Honolulu. Overwhelmed. I brought it home, showed it to my dad. He was overwhelmed. But he had made a decision to take it. And soon after getting it, that's what he wanted to do. Well, September 15th, he ended up in the hospital. He was 115 pounds, frail, hardly ate, suffering, fractured his shoulder. They couldn't do much for him, right, because of everything he's gone through. So the next day, on September 16th, that morning he decided he had enough. He was hardly slept. He was in a lot of pain. So around 11:30, he told me to get everything ready. So I got all the bottles out, got everything prepared. It was hard. I cried, I had anxiety, I shook. I had to open 8 bottles. I couldn't do it by myself. So I had a little assistance from my family. But it was the most peaceful process after the consumption. And up until that point, he was at home. He wasn't alone. We were present, his little family, myself, my mom, my sister, and my husband. And doing this process allowed this to happen. It's my mom and my dad. It was peaceful. Took about maybe 10 minutes. But he was comfortable and he was at home and we were with him. And that's all that mattered. We're super thankful for this MAiD process, even though it can be improved overall. But this process is necessary for patients like my dad, for families like us. I would want to do this one day. That's my choice, and I hope it's still around for me to partake and many others. I thank each and one of you out there for being a part of this process and for learning more about this process. Thank you for your time.
Thank you so much, Mommy. I'm gonna hit you up there on the screen.
Hi, Mommy. Thank you for sharing your dad's story with us. I know it was really hard, and we really appreciate the opportunity to learn from you. I know you felt a lot of distress around the drugs themselves. You attended a training to learn how to assist your dad with the life-ending medication mixing. Do you feel like it was helpful, and how do you think the distress could have been lessened?
It was helpful. What would have been even better is if we had received the training prior to maybe obtaining the medication or at the same time. For us, it definitely came after the pickup. And through our discussions with the doctors, through the process, no one mentioned that we would be getting multiple bottles of medication. We were kind of under the assumption it would have been in one little tiny packet that we would just pour the contents out into a cup. And it was not that way. It would be really helpful just to have that discussion beforehand with the patients and the family members that are a part of it or will be there that day. And really to provide more mental grieving support during the process. If my husband didn't come with me the day of to meet with the oncology pharmacist to discuss the medication and the preparations, I don't think I would have made it home. It was hard. I cried the entire time.
It's common for loved ones who participated in medical aid in dying to feel a sense of guilt, as if they were the ones that killed their loved ones instead of the disease. Did you experience anything like that? And how would you suggest that the burden on the loved ones could be reduced by healthcare professionals?
The guilt that I killed my dad guilt came several weeks after, and it hit me like a ton of bricks, and I had a very, very difficult time with it, even though I knew it was the cancer. It's just I was a part of the process, which I would do again and again and again. Just nothing prepared me for that. And I feel just having more of a mental support or some type of support where all of this is truly discussed based off of like all the feelings that can come up, and families are involved. There might be tension, and how do you deal with that? And everybody's journey is different, and I just feel more needs to be done prior to just really prepare everyone.
Well, thank you. Thank you very much for sharing with us. And as a reminder to everyone, we will have an opportunity to ask Mommy more questions later. And if you have any questions, you can put them in the chat. And thank you, Mommy. Our next contributor is Louise Barnfield.
Barnfield, and I live on Kauai. My darling husband, Steve Smart, died from lung cancer late September 2021. He was 67. In 2018, Steve was diagnosed with early stage lung cancer. He had surgery followed by a few months of chemo, and we hoped we were home free. But in late 2019, the cancer was back in both lungs and far more aggressive. So he then endured almost 18 months of various chemo cocktails with a host of truly ghastly side effects. We went through it all together, me being his first line of defense during the worst of COVID. But in February 21, we were told we'd run out of treatment options, and Steve signed up with Kauai Hospice. I am so very grateful for them. They were a huge support to us both through those months. Once we knew his disease was terminal, we were relieved that Hawaii allows for medical aid in dying. Thankfully, we had Michelle Cantillo on Oahu to guide us through the process. We were more fortunate than many in that we had the time and the resources to put everything in place and then be able to focus on the remaining time we had together, knowing he had that ultimate option if he wished. We did learn that the process is lengthy, confusing, and stressful at so many stages. The wait times for multiple approvals, the fact that the prescription is only valid for a month if you choose not to immediately fill it, and the meds come from Oahu, so we had to order well in advance to have them just in case. Even the step-by-step instructions for administering the multiple drugs are unnecessarily confusing and stressful at such a difficult time. I should say now, we did get the meds, and I rehearsed all the steps, but we didn't use them. In the days before Steve died, he discussed it several times. He talked through his list of prerequisites for continuing to live and whether he'd reached his limit. But he decided he was still enjoying time with me, reminiscing about our lives, reading, just being alive. The night he died, we'd watched TV, we'd chatted and even laughed together. But at 2 a.m., he woke me struggling to breathe. I stayed awake with him all that night, giving him the prescribed morphine for comfort, holding him, talking to him, loving him, and he died very peacefully at 8 a.m. Though he didn't use the meds, we experienced some disappointing issues. One is that hospice are not able to take a completely unhindered role through the MAiD process. It's simply heartless to prevent them being with the patient and family right up to the end. Also, to ensure that the meds are immediately available, whether or not they're used, means a very large, non-refundable expense up front. We were lucky we could afford it, but many would struggle with the cost at hundreds of dollars. Which brings me to when the meds are not used. So after Steve died, a deeply distressed and emotional wife with a well-rehearsed knowledge of how to administer end-of-life meds was left with them sitting in our refrigerator indefinitely because hospice did not have the authority to remove them as they did all the less harmful drugs immediately after his death. I then had to research how to dispose of the package, which meant finding a day and a time to drive to a pharmacy 15 miles away. That is an appalling omission in the process. No one should be left alone with those meds after a loved one has died. Anyway, although we didn't ultimately use the MAiD meds, I hope that telling the story of our experience is valuable for others. The comfort of having that option was enough to make our last few months together far easier to bear than they might otherwise have been. Thanks for listening.
Thank you so much, Louise, for sharing your story. Also, you have such an awesome background. Do you mind sharing real quickly what it is?
Those are Laysan albatross, and that was taken on Midway Island in the northwestern Hawaiian Islands, where probably about 96% of the world's population of Laysan albatross are. And I go back every other year to help with the count that we do. We count all the nests on Midway, and it is the most glorious place to be, and it's soul food for me.
Awesome. Thank you for sharing that. I thought people might want to know because it's such a cool picture. Thank you. And thank you so much for sharing your story and for giving us a glimpse into your life with Steve. We just appreciate you so much for being here today. My first question for you is, how did you and Steve feel when you first heard about medical aid in dying?
Well, we researched it ourselves, really. We looked online because it's something we talked about in the past, and both of us would very much wish to have available. And so we found out that Hawaii did have it available. And then from there, we discussed it with our hospice nurse, and they were able to put us in touch with people to start the process.
Thank you. Did you feel supported by your medical providers?
Yes, I think the others were saying the same thing. Yes, mostly. Most of the process was amazing because Hawaii Pacific Health has an advanced care planning coordinator, and that's the Michelle Cantillo that Clark mentioned as well. And I'm just so grateful for her and hospice, who together just helped me through the whole process. And she kept us on the straight and narrow through all the different stages, because it really is quite overwhelming to try and figure out all the different time lapses and everything you have to deal with. Our one problem was, disappointingly, our primary care physician, who he didn't want to participate, which is absolutely fine. I totally understand there are different attitudes, and the problem was he kind of ghosted us. It was during COVID, so I couldn't visit the surgery to speak to him, and so we phoned, explained what it was all about, and we just never got a reply. I think I tried 3 times, nothing. And again, it was Michelle, bless her, who when I got hold of her, she finally got hold of them, and that's when he said he wasn't comfortable doing it. So that was a delay, and it was also upsetting, really, really upsetting. I totally understand that people have their own attitudes. I just wish he told us that straight off. So other than that, it all went very smoothly, really, as much as it can, because it is complex, and all the instructions that come with the meds, even those are overwhelming. And our hospice staff were wonderful in talking us through that. We had the benefit, unlike Momi, of going through it way before the event. and explaining just the different things that would happen and also how to do it. So I'm really grateful for everybody else that we had.
Thank you. And yes, that is distressing that they didn't reply, and I'm so sorry that happened. I do wish that folks would be upfront if they're not willing to participate in this process. But I'm glad that you found other folks that were supportive and helpful.
Absolutely.
And I just have one more question for you. Is you mentioned in the video that having to dispose of the medication yourself was very distressing, and understandably so. Do you think it would have been better to have waited to fill the prescription if you hadn't had so many barriers to receiving the medication?
Yes. Firstly, I'd say I'm not sure it was so much distressing as shocking. It was a surprise. And it didn't really hit me until sort of a little bit after the event, just how I might have reacted if I'd been somebody who was less willing to live herself without her husband. But yes, absolutely, because on Kauai we were warned that the prescription would be filled in Oahu, and we would then be sent the meds. And although they warned us it would be some days, we didn't know how many. And Steve was worried that he would want to use them quickly, and if we didn't have them immediately, he wanted to use them, that he would get beyond the ability to ingest it, as the patient has to do themselves. So absolutely, we got them well in advance, and it would be much better if the drugs were available on the islands, or just more quickly available. I think it would also save the expense for those people who can't afford it. I mean, I'd love a buyback program for people who don't use the meds. We were able to afford it, but many people can't, and that's one of the things that would be nice to change.
Thank you so much for sharing that. I think that's really important for everybody to know. Thank you. And thank you so much again for being here with us today. And just a reminder to all the folks on the Zoom that you will get a chance to ask Louise questions as well at the end if you have any questions specifically for her. So thank you. I'm going to get the next video started. Give me one moment. Thank you, everybody. And while you're waiting for that, just to say that our next person is David Sadker, and I'm going to get that video up and running for you. Thank you so much.
My name is David Sadker, and I'm going to tell you the story of my wife Karen's last year. Karen had sepsis infection for a number of years, but in the last year, she began losing weight. And it was dramatic loss. She went to the doctors, who asked her to get infusions of potassium, and the potassium infusions became a catch-22. The more infusions she got, the more diarrhea she had, and the more loss of potassium she had. She was admitted to the hospital for a month, where the infusions intensified, and so did her weakness and her illness and her weeping edema. And the last day in the hospital, I remember she said to me, I've never felt this sick before. The last day, the doctor came over and said, we've done $1 million worth of tests on you. We find no problem. So the problem, Karen, is you. How crushing is that your one ally in getting healthy again is blaming you for being sick? Karen was sent home, and over the next 3 months got weaker, lost more weight. She went from 106 to 55 pounds, losing it all in diarrhea. But the doctor said she should see a psychiatrist because she was anorexic. Now, her body was certainly anorexic, but it wasn't a psychiatrist who could help her. Her small intestine was not gleaning any nutrients from her eating. It was passing right through her. After months of pain and inability to walk, and towards the end, loss of vision, Karen said, I want to die. Let's look into medically assisted death, which we did. And then we realized that we'd have other hurdles because the doctor at the hospital had also written down she seemed very depressed to me. So now her mental competence was at stake, and she would have to go through another series of tests to show that she was mentally sound. She couldn't even move. What do we do? And she decided not to take food and water, and that's how she died. And after that event, we realized, had she taken the end-of-life medicine, which gets absorbed through a small intestine, she might have woken up. It might not have been absorbed. A bad diagnosis for her health was also a bad diagnosis for how to die. At the end of her life, she should not have faced those kinds of hurdles. Death should not be that harmful for Karen or for anyone.
Thank you, David, for sharing with us. Karen's decision to stop fighting for medical aid in dying was predicated by the fact that she was in great suffering, and dying from a lack of nutrients in medical aid in dying process could take at a minimum of 20 days from first request to second oral request by the current law. Do you think if she hadn't hit that mental health barrier, she would have been able to sustain life for 20 days?
No. I remember hearing the 20 days the first time and saying, well, that's not going to be too bad. That's 3 weeks. Karen heard it very differently. I don't know if I can make one more day with this pain. 20 days to someone in excruciating pain is an eternity. And that's what we faced.
Now, out of the 5 participants here, David, you're the only one that hired an end-of-life doula. Why did you choose to do that? And what did you learn from the experience? What did your end-of-life doula do or not do to help you with your experience?
Well, everything in medicine was going south. Every treatment was creating worse pain. Nothing was even approaching the problem, and they were creating more problems. So I was down on medicine. I've lost other people in my life, and they died in a hospital. A hospital is a terrible place to die. So I wanted to do this right. And the doula helped us keep our heads straight, helped us understand the law, and helped us understand alternatives, one of which ended up taking Karen's life. She stopped taking food and liquid, and within 6 to 8 hours from that decision, she died. So there's no way she could have lasted 20 days. The transition was the most beautiful part of the whole process.
Thank you, David, for sharing with us. As a reminder, everyone will have an opportunity to ask David questions at the end of this presentation. And we'll now move on to our next video. Thank you.
Hello, my name is Lisa Griffith, and I assisted my mother with medical aid in dying in June 13th, 2022. She had been diagnosed with stage 4 non-small cell lung cancer in 2019, and when she learned that there was no effective treatment for her type of cancer, one of the first things she told her oncologist was she was interested in medical aid in dying. He was very supportive of it as an option and said when the time came, he would put us in touch with a colleague of his because he himself did not deal with medical aid in dying. And when the time did come, That other oncologist was a very busy oncologist, so it took many weeks before Mom could see him for her initial evaluation. Then it took a long time before she got a reference for a psychiatrist for the psychiatric evaluation. That psychiatrist couldn't see Mom for 6 weeks. Then it took 3 weeks for the evaluation to make its way from the psychiatrist to the oncologist. The psychiatrist said that he had sent it right away. The oncologist said he didn't receive it. I just took a lot of advocating on our own part to find out what happened and make sure it went through. And then after that, we got a very simple email, just said the doctor has sent the prescription into the pharmacy, and then that was it. It seemed like such a disconnect from all the long process to getting the medication. We're kind of just left out on our own. And we did get good support from our sort of pre-hospice program Mom had from her insurance. They offered resources, very good social services advice. But then when she moved to full hospice with the same organization, the second team seemed much less familiar with medical aid in dying. The 2 nurses that were assigned to record Mom's death had never done anything like that before. Also, before that, the oncologist's office, whenever we talked to their admin people about medical aid in dying, they kind of seemed to have a visceral reaction, like, oh. And I just feel like there could be better education among all stages of staff regarding medical aid in dying. The day of, my brother and I handled the medication. The instructions in our medication said to actually take a tine of a fork or something and actually taste it. The medication, which I was very surprised. It left my tongue numb for an hour. Then we applied it, and it went very, very quickly. My mother only weighed about 70 pounds by that time, and I wish there had been some sort of information on the instructions. It said the reaction could be from 5 minutes to half an hour, and hers was the 5 minutes. It just happened so quickly, and I don't know, in hindsight, I wish I had secured a death doula to help through the process. We're very grateful to have had this option, but I strongly feel that there are ways to make the process even better. My mom was grateful, I'm grateful, and I would like to help make it an even better option. Thank you.
Thank you. Thank you so much for sharing with us today. And also, just to add that Lisa also wrote a story about her mom's dying process and that experience, which one of my co-hosts will cut and paste into the chat for y'all if you would like to read it. It's incredibly moving. So thank you so much, Lisa, for being here with us today, but also all the advocacy that you've already been doing. We appreciate you so much. My first question for you was how, you talked about, this ended up being a pretty long experience for you and your mother. How long between when she received how long did it take for her to get the drugs in the end? How long did the process take?
How long did it take to get the drugs from start to finish?
Mm-hmm.
We picked it up in March, and I think it was about 3 months.
Mm-hmm. Okay. Do you think it would have been better to have kept them at the pharmacy until she was ready for them?
No, that wasn't anything that worried us. I mean, we picked it up in March, and we put it up on a shelf and kind of forgot about it a little bit. And, each day Mom would say, I'm still happy to wake up and, and be here. And then the first day, she said, I'm not glad to wake up. I'm not glad to be here. And that's when she just knew. Yeah.
Okay. So she truly just knew one day it was time.
Yeah.
Okay. Thank you for sharing that. And then the last question I had is, how could medical practitioners have made this process better or easier for you and your mom?
Well, kind of like I said, if just people were more educated all along the way, but it is, in hindsight, I just realized it is so new. They just haven't had a lot of opportunity to, get to know the process. I guess it would be, my mom was in the Queen system, and they certainly could use someone like at Hawaii Pacific Health to help navigate that. It's a huge system. I guess it's just going to take time for people to encounter patients who want to choose this option. It would be great if they had sort of, seminars and addressed, large groups of staff. And from receptionists to practicing doctors, all at once. But I don't know how viable that is,
Thank you so much for being here and sharing all that with us today. And also, I just wanted to note that how screen share works is that the transcript box was covering up one of the photos from Lisa's collage, and the photo was covering up, in case folks were wondering, was the picture of all the medication bottles. So just to FYI, that's what was being covered up in the collage, unfortunately. So sorry for that. But so this reaches the end of our portion of the event, where we're going to be showing folks videos. So just give me a moment, and I'm going to spotlight all of the wonderful humans that you heard from today, and then you all have a chance to ask questions of them if you have any. So just give us one moment. As stated at the beginning, if you have questions, you can put them in the chat, or you can also raise your hand and we will call on you, but please don't unmute yourself unless you've been called on. So appreciate that if you could just give us a moment. And also just that we are going to limit the speaking to 2 minutes, and we'll give you a warning at about 1.5 minutes, just because we have a lot of folks here today, and we really want to make sure that people get a chance to ask questions. And I'm missing David. I got to find you. It's wonderful. We've had such a good turnout today. Thank you so much. It's making me hard to find speakers. So, and I see we have a hand raised, and I'm going to go ahead and pull up the chat. And once again, thank you so much. Thank you so much for answering questions for folks today. Also to say, I forgot to mention again, if you have a question for somebody specific, please also, if you are putting a question in the chat, let us know who it's for, if it's for someone specific. So I see that Haley has their hand raised, so I'm going to go ahead and ask you to unmute yourself, and you can put your hand down whenever you get a chance. So thank you for being our first person asking questions.
Thank you so much. Thanks, Leilani. Thank you to everyone for sharing your stories. It was amazing to hear. You might hear I'm calling from another island. It's called Australia. It's quite far away from where all of you are. But I'm really pleased to talk to you because I'm a hospice worker here in grief and loss, and we also have laws around medical assistance in dying, and I'm doing more work around health professional education. But what I wanted to ask is, as the months have gone by, what do you notice in your sense of grief, which might be impacted biomedical assistance and dying. Momi, you said some really important things around guilt and how difficult that is, but really to anyone, if you have reflections on your grief afterwards.
I don't know if I'm answering it, but I never did have any sense of guilt. I don't know why. Maybe it's just because we were both for this, and I didn't have any sense of guilt for helping my wife do the process. And everybody's different, you know. She went out on her own terms.
I would like to add that for me, I was really shocked that I had that guilt because I was on board. I was my dad's medical advocate. I did everything for him, and I knew it is what he had wanted. And I respected his wishes, and I did my daughterly duty, and I would do it again over and over and over again. So when that came about, like it hit me hard, and I'm just grateful that I've already had a therapist in place, and I had found the MAiD group. And my dad visited me, and he showed me what would have been, and that validation from him after his passing is what made everything a little better. I needed that connection with him.
Yeah, thank you, Momi. That's beautiful.
Lisa, would you like to speak to this question?
I had a similar experience with Clark. My mom knew from the get-go that she wanted to pursue that option, and she was Buddhist. She faced death, just very courageously, accepting in a very accepting manner, and knowing that I was helping do what she wanted, made me feel good. I mean, I think sort of after the fact, I might be experiencing some things similar to Momi. I mean, not guilty for what I did, but I mean, for helping her, but just, I guess it's the normal guilt after any death, things I wish I had said, or, just there's never enough time for anything you want to do, is there in this case? But yeah.
Thank you.
I think I would have felt far more guilt if I allowed Karen to go day after day in extreme pain. That would be hard to live with. Knowing she's out of pain and believing she's still with me gives me grace along with the guilt. The guilt I don't have. So I'm grieving, but I'm proud of what we did together.
That's beautiful. Thank you. Thanks so much.
And thank you for your question. I got a question from the chat, and I see Mary Elizabeth, you have your hand raised, so you'll be after this one. Layla wrote, thank you to all of you for sharing your stories. A general question for those whose loved ones took the meds. Do you think it would make sense to have the meds sooner in the process rather than suffering through months of chemo first? Clark, do you mind answering first?
Well, for us, and we got the meds, it was just one vial. It was all pre-mixed. So I'm just shocked that Lisa and Momi had to mix all these vials of meds and to taste test. Who in their right mind would taste test a death drug? Or tell you to taste it. It just doesn't make sense. But back to the question, I don't know. The drugs were good for 6 months. I'm not sure why Louisa's was only 1 month, but ours were good for 6 months once we got it. And I don't know. I mean, we had them long enough, and we even got them, opened them up, and read the process, the directions, and everything several times. But I don't know if it would have helped us having them sooner,
Just to clarify, it's not the drugs. The drugs, you're absolutely right, expire after 6 months. We knew that. It's actually the prescription. Once you get the prescription and you ask to get the prescription and then you choose not to fill it, the prescription itself expires after a month. That's what we were told.
Okay.
Oh, that's just another thing you have to juggle with.
Right.
As to the question of whether we would have had the drugs sooner rather than suffer through the chemo, no, I don't think so at all. I think Steve and I were prepared. It was horrible to see him go through the side effects, but he certainly wasn't in a position to want to take these drugs until he got to the stage where there was absolutely no hope. And actually it was still down the line as to basically being incapacitated would have been his decision. So no, he wouldn't have taken it earlier without going through all the treatments.
And I just want to go ahead and read Lisa's answer that she put in the chat. In my mom's case, she did not physically experience pain or suffering until 2 years after her initial diagnosis, which included a brief chemo treatment. So no, in my experience. Okay. That's the chime noise that time for us to move on to the next question. Thank you, Danielle. And thank you for answering that question. And thank you, Layla, for asking it. So the next person with their hand raised is Mary Elizabeth. If you'd like to unmute yourself and put your hand down. Thank you.
So the question that I have is actually, Louise, you had said that Steve had criteria for when he thought it was going to be appropriate to use it. Would you mind sharing what some of those criteria were? And to the other panelists, did your family members have any type of criteria that they had expressed to you that they had wanted to use as their endpoint? Like, this is the point that I want to actually mix those meds and go through with it.
Yeah, I don't mind sharing at all as long as people are prepared for TMI. Basically, it was all about dignity for both of us. It's absolutely about being able to sort of care for yourself to a certain extent. So his whole attitude when he thought about it and just trying to decide what was going to be his cutoff point was really if he couldn't go to the bathroom on his own. We had helping things like, the stands around the toilet seat, and we had bars for him to hold on to, and he used all of those to get there, but he was still able to do that. I must admit, we were in the shower together. I would shower him down because that was difficult for him, but he accepted that, and we even had a chair ready for him to sit in the shower. I think he used that once. So those sorts of things, it was more the fact that he would analyze it in the evenings, and we'd sit there and, I don't know, watch Jeopardy and all sorts of things. And he just said he was happy still living and happy reminiscing, which we did a lot of those last few months. That's why I'm so grateful that we had those months. But no, that's the basic. Look after yourself and keep yourself clean. And other than that, he felt life wasn't worth living.
I guess with Nancy and I, it was different. She never did say a criteria, but I just was, I knew that she would say when enough was enough, and that's what happened. That she didn't come up with any criteria or anything, and I'm sure, and we never got to the point where she was in diapers or anything, and it's just the constant vomiting. And knowing she couldn't ingest water and food anymore, that was her point of no return.
For my dad, he was afraid of the aftermath of the cancer spreading to his brain, possible stroke, losing eyesight. I mean, he was already in pain, and I think really what sent him over the edge for him was that he had fractured his shoulder, and they couldn't really do anything for him. And at that point, you see in the photo, he was skin and bones and wasn't eating, not sleeping, uncomfortable, in a lot of pain. And like I said, he woke up that Friday morning and was kind of okay. I could tell he was still trying to make his decision. And literally at 11:30, he just said, "Game on, I'm ready."
Thank you so much for your question, and thank you everyone who answered. And just to remind folks, you can put it in the chat or raise your hand. And I have a few questions here that actually, when folks registered, they sent us some questions too. So we have those questions ready as well. The next question I have for folks is, knowing what you know now, what do you wish providers had prepared you with prior to your loved ones going through MAiD? And I think if Lisa, if it's okay if I ask you that question first.
Yeah, I think sort of I would have appreciated kind of a blow by blow of what to expect. Once the patient takes the medication, my mom, it wasn't really she didn't kind of peacefully fall asleep, but she took the drug and talked briefly, and then it was just sort of shoo. It was almost like a cartoon when a cartoon character just kind of turns to stone. It took me and my brother by surprise. She was still sitting up, so we kind of panicked and we're like, we have to lay her down. And then we thought she was in a deep sleep. We weren't sure if she was gone yet. And then she took one deep breath, which scared the shit out of us, I'll be frank. And so just that kind of stuff, that would have, just a real helpful thing. We had a very great social worker who did give us contacts for 2 death doulas. One of them was Joy, and that's, why I've said, in hindsight, I wish we had gotten someone, but, it was just sort of more of a suggestion. I think if he had strongly, highly recommended it, maybe, my mom, who was a very thrifty person, who was like, no, we need to hire anyone. If they had really, really emphasized that it would help the process, that would have been good too.
Thank you for that, Lisa. Momi, would you mind answering that question?
I will have to mimic Lisa. The gasping was very alarming. My dad did do that after, lying down and going through the process. I mean, that scared the shit out. I ran into the other room and I started freaking out. I thought he was going to wake up. I think it might have been mentioned, but again, mentioning it and going through it is 2 different things. Definitely for me, my advocating is that medication, the 8 bottles was just too much, and having more social, more mental, more just overall the process of just all the little nuances that could possibly happen, just to prepare everyone a little better instead of being so black and white, just adding more heart to it.
And I can attest to how important that is, because on the other side of it, from Lisa and Momi, I would say that I did have that support, and I can tell you what a huge difference it makes. Our hospice nurse was just amazing in terms of just being very open and matter of fact, being able to discuss it, because we were very open about it, and explaining what might or might not happen, even though we didn't actually go through it. We felt really prepared, and there are things like that just made all the difference for us, and gave us the comfort of those last few months with Steve. And so I can vouch for what the difference is when you do have that kind of support, that, and also the advanced care planning coordinator, Michelle, who just, I'm not sure how we would have managed it without either hospice nurse and her together. We were a team, and I'm very, very grateful for that, and I wish everybody could have that.
Yes, that was very good to have Michelle involved in that process. And we never experienced, I mean, we read about it. I think our hospice nurse even did discuss it some, but when Nancy passed, there was no gasping, no, I mean, she just went to sleep and that was it. And I'll always be proud I helped her through that process.
Thank you, everybody. I have a question in the chat that actually, it was mentioned, in the question piece that, David, you are the only person that utilized an end-of-life doula to be present to assist and be there for you during Karen's process. So I have a question in the chat. Did anyone else have anyone present to help in the room with the ingestion process or afterwards? Well, I know some folks were by themselves, but was anyone else helpful or stepped up to assist folks at all?
Well, the hospice doctor, Dr. Long and Miriam, were both present, but they left the room when the meds were administered. And then when Nancy stopped breathing, I texted them and they came back in, and those are very supportive.
Sorry.
Go ahead. I was finished.
The hospice we used, they said, call us when your mom's dead. And I'm like, well, I want you there so we know when she's dead. And I had to, advocate for us to have them at least be, on the grounds of our apartment so that they could come quickly. Otherwise, they weren't going to be nearby, which, yeah, that sucked.
Yes, they were there, and right away the nurse, was able, within 15 minutes of taking the meds, she was pronounced dead. She had no heartbeat. So it was good.
I'm sorry, Clark, are you finished?
No, I'm just saying it was good that they were there and supportive.
There are also unintended or expected benefits from having a doula there, and Joy was our doula as well. So when Karen was just dying from her disease, I went into a hospital bed with her, and we cuddled, and I fell asleep. And Joy was watching this. When I woke up a couple of hours later, Joy said that Karen died about half an hour ago. And she had a smile on her face. If Joy wasn't there, no one would have seen the smile.
Thank you, David, for sharing that. And that, which, leads to another question. I see we have two more in the chat after this, but, as I mentioned, and David mentioned, he worked with Joy as an end-of-life doula. And looking back for the other four of you, do you think that you might have made a different decision around having an end-of-life doula present to assist?
We would have, for sure. Yeah.
I don't know. I didn't even know they existed until I met Joy. So
Yeah, same here. I didn't know they existed until this group, really, and meeting you folks.
Well, thank you.
I'd just say I guess that's kind of how I treated our hospice nurse at the time. I mean, it's different if people aren't in hospice, I suppose, but we've been in hospice for so many months and we were so close to her that I feel like she would have fulfilled that kind of role. In fact, I know that she was on the phone with the hospice those hours before Steve died, checking on his progress, because I kept calling to ask what drugs I could give him without killing him, which is ironic given that he died within hours after that. But she was on her way. I mean, she phoned me and said, or I phoned her, I think, and she said she was on her way, already on the road, coming up to me after he died. And so I feel like in my circumstance, I did have effectively a doula in her. So, but that's why it's important.
Thank you. We have a few more questions in the chat. One question, was everyone's family member linked to hospice during this process? Yes.
Mine was, for sure.
Yes, so I think yes, everybody's was. And then the next question is, I think it was David who mentioned that medical providers brought up concerns about documented depression in a medical chart. Do all patients desiring medical aid in dying require a psychiatric evaluation? And if so, what was the process like? So I will answer the first part of that, which is yes. I actually volunteer doing those as a therapist. And so in Hawaii, and I know some of our guests here on the Zoom are not in Hawaii, but it's part of our law here. It's one of the steps in accessing the medical aid in dying process is getting a capacity evaluation from a psychiatrist, psychologist, or licensed clinical social worker. So that is part of our law. And would anybody like to answer if you were a part of that process for your loved one?
Yes, I was in on it was a Zoom call with a psychologist, with Nancy, and just answers standard questions and everything. But when she got the little readout, the psychologist said she's got anxiety. Well, who the hell doesn't? You're talking about dying, you don't have anxiety, But she was deemed okay to take the meds, but that kind of tweaked her off. She was a little upset about that. You have anxiety? Well, yeah.
That was exactly the same with Steve. I mean, he just laughed it off with the doctor, but it's kind of ridiculous. Well, yeah, I'm dying, but other than that, I'm all right.
And I see some folks actually answered that in the chat as well, that Momi said, yes, my dad did have to answer a series of questions, and a few of those questions were related to mental health history. And Lisa wrote, my mom's application required a mental evaluation. She had a regular doctor's appointment. I did not accompany her to that, but she said it was smooth and psychiatrists had no hesitation. That's nice to hear it went well. And then Dr. Sharfin on Hawaii Island answered the question as well about, yes, it's necessary. And unfortunately, as far as I know, I think that is true, that we're the only state left that requires this evaluation.
I wanted to chime in also, this is Joy, and just say that it is part of our law that we cannot have untreated depression. Mm-hmm. Our patients, to qualify, that is one of the qualifying.
Thank you, Joy, for chiming in on that one. We got some thank yous, and then we have another question. What were the panelists' families and friends' responses when you shared that your loved one had used MAiD?
For those that know my dad, it wasn't a surprise at all. We are very open about the process because we want more people to know about it. And bottom line is they knew my dad well, and they knew it was his choice, and there was no other way around it. He was going to make it happen whether we were part of it or not.
Well, Nancy chose to share it with a few close friends and some of her family. Most of my family doesn't know. Only one sister I told. It's personal, and just like our bereavement group is personal, but it's a safe place for us to share this stuff where you wouldn't normally share that with people.
Same thing for Steve. He shared it with close friends and family. We had a lot of support, and people understood, again, it was his choice. Most people actually wanted to know more about it because they would have chosen it themselves, so they wanted to know. I don't think we didn't tell very many people. I certainly didn't tell people outside of the people that Steve told until he died. And once he died, I felt that the benefit to us to having that option, even though we didn't use it, was so great that I wanted to advocate for it. And so now whenever I get the opportunity, I talk to other friends and people I know. I don't know whether they agree with our decision or not, but that doesn't matter. Everybody has their own opinion, and I feel like it should be better known by everyone. And I also want to advocate for the changes that I think are needed to make it even better.
Question, actually, this is a question for me that came up listening to everybody's answers. Is it helpful to be attending a bereavement support group that's specifically for other people who have walked with loved ones through a medical aid and dying process?
Very much so. Very important.
I wish I'd found this group before it all happened.
Grieving is not easy.
Momi brings up a good point that to know about a group where you can go to even before you go through it would be a huge benefit as well.
And I think one thing that stands out to me is I know that Louise, when I first met you, I remember, I think maybe the first time we ever met, you said, I would be happy to talk with others who are thinking about this. And just to put that out there, that that is, number one, a beautiful thing that you're willing to share your experiences and willing to be there to answer questions for others. But also that it's so nice to have met you all and had this group together where folks can talk freely about this, and also to know that we exist, so that if people out there, and I guess I'm talking to you all in the Zoom universe on this Zoom, to reach out to us. You know, if you have questions, if you have people that you think would benefit from linking up with any of us, please, you all have my email from sending out the registration info. Please don't hesitate to reach out to us if you feel like you want to ask questions or want to talk more about support or learning more from others who've gone through this process. We've got time for maybe one more question, and then we're gonna close out. And so I don't see any new questions, unless I'm missing anything in the chat, and nobody's hand is raised. So I think I will just ask one more from our list before we head out. In terms of support or other factors, has anything else helped or hindered you in your experience of grief?
I'm not sure that question. That's just, grief is grief, and it's, this group is there, and it's definitely helped me through my grief. You know, knowing other people have shared the same thing, and grief is very personal, and it comes up and hits you sometimes when you least expect it. So I'm not sure how to answer that. But
when in your process of all of going, the whole process you went through, when would you have liked to have heard about a bereavement group?
I don't know, it kind of happened like right after Nancy passed, this group formed, a few months later, and it really, might have been nice to know about it before, but it just kind of was starting, and the idea was out there, and Joy and Leilani ran with it, and I'm glad. Very grateful.
I know for myself personally, I started to get very angry prior to everything. It was 2 years of constant doctor's appointments and chemo and watching my dad basically perish. I started to get very angry, so I sought out help, and it was the right match with the right person. She listened to me. She offered a lot of advice. Even she said at that time to find a support group. And I didn't find MAiD. It was everything just happened so fast that I didn't have the time to connect with a support group or find out about this MAiD group. But for myself personally, I had to reach out to somebody to help me through this process before everything happened.
I found this group is it's been a godsend for me, I think, because it's a very different experience than, say, the hospice that we were with continues to send me lists of, just for general grief support groups. And I just think it would be a very different experience, say, if I was in a large group of people and someone had someone who died, like, say, in a car accident, or went through a sudden illness. It's a very different experience to have kind of this controlled, knowing, informed manner of death. And I think, grief is grief, but I think the experience would be very different. And so having this group is very important to me.
I'd say that we talked about when in the process, and we talked about having support beforehand could be important. And Mummy highlighted the fact that she sought sort of one-on-one, or she sought out support. I was tempted to say that a group should be there for the caregivers before those people who have chosen to use it but haven't used it yet. And then I thought about my own circumstance, and I thought, I'm not sure I would want that. I was very grateful that through Hawaii Pacific Health, Michelle put me in touch with somebody who'd helped a friend through it, one of the very, very early ones on Kauai. And I did get together with her. We met for coffee and we had the most amazing talk, and that helped me enormously to understand what to expect when somebody had actually been through the process. After that, I don't think I would have wanted to attend a sort of a weekly or a monthly group session at that point, because once we had the meds, it was kind of good just to be able, like I think Lisa said, to put it out of your mind, know that they were there, and that you could rely on them as soon as ever Steve decided to use them. But other than that, much as I love this now every month, I don't think I would have wanted to do that prior to.
Thank you, Louise. And we're at time. So I'm so sorry. I know there's more questions, so much more to say, but Joy, did you want to lead us out?
Well, just thank you everyone for attending. A recording will be made available soon. And as a reminder, we continue to offer our no-cost bereavement groups on the last Sunday of the month for Hawaii residents and the first Sunday of the month for everyone, both over Zoom. So thank you. Thank you everyone for sharing. Thank you so much for sharing. And if you guys, if the audience would like any other particular questions answered, please feel free to contact myself or Leilani, and we will make sure that it gets to the right person and you get your questions answered. Thank you for taking your time out of your schedule to sit and hear us, because this was a driving need of these 5 participants to be heard. And thank you for showing up and hearing them. Everyone take care.